Thank you. Thank you so much, Lynn. Lynn is more than just the dean of one of the nation's very best schools of public health. She's a renowned epidemiologist. She is a pediatrician, and she is a doctor of public health, of course. And deep down inside, she's a really, really good person. I've known Lynn for over 20 years, and she's wonderful. I'm not going to have any comments here because I just have to introduce the good senator, and I can't begin to list all the things that he has done. I had dinner sitting next to him in Fennell Hall in the mid-1990s when he was still in the House of Representatives. And we talked about how difficult politics was, and we talked about raising money for politics. And he said something, he said, it used to be easy when I got started, I would just hold up a picture of Richard Nixon and I would get money. Right. And now, you know, the whole politics thing, it's a different world. We would pray for those days back there when it was. So I want to thank him for he's going to tell us what's going on now in Congress and in climate. And I'm not going to try to say much about now, but I want to thank him in particular for Waxman Markey. If that had passed, we'd be in a different world. We'd be in a much better place right now. It was a very prescient bill. He and I was on the board of EDF, then we all work like dogs, and stupid Senate. And then so he decided he's going to go take over the Senate so that he doesn't have to have that obstacle anymore in his way. But also then, of course, the Green New Deal thing has broken out into some spokes here. And there's one for climate and there's one for health, both of which he's sponsoring. And it'll be very, very good to see those things passed. And then, of course, he's partnering with Representative Tonko on the Community Mental Health and Resilience Act. And for all of you guys who know ecoAmerica, we are big on mental health. Children's mental health report is coming out on October 1st. But Senator Markey, please come.
Thank you so much, Bob, and thank you for everything that you do every single day, and everything that your incredible organization does every single day, and everything that everybody who is here. Thank you for your efforts. Thank you, Dr. Goldman, for everything that you do. I'm married to a public health doctor. My wife, Dr. Susan Blumenthal, was a 2-star admiral in the public health service of the country. A 2-star admiral, ran all women's health in the United States in the Clinton administration. You know, I married the dream. I married a Jewish doctor as an Irish Catholic politician from Boston. And I know that public health is absolutely at the core of all of our lives. And I appreciate very much everything that all of you do every single day. Health is the first wealth, Ralph Waldo Emerson. And all of the issues that you're working on every single day is at the core of what we have to try to advance urgently as the agenda for the country. Yes, I was elected to Congress 47 years ago, and they elected children briefly because Richard Nixon was president of the United States. And I was very grateful to Richard Nixon. But now we need a poster size Trump picture that everyone can see every single day, because he is a climate denier. He is someone who doesn't want to do anything about it, and catastrophic consequences for everyone in our society is absolutely impossible to fully calculate. So that's why with Alexandria Ocasio-Cortez, I introduced the Green New Deal, because we needed a movement that would then create the momentum by which we would then be able to pass legislation last year for wind, solar, all electric vehicles, battery storage technologies that are essential to solving the climate problem. It's why I tried with Henry Waxman and passed through the House of Representatives the Waxman Markey bill, which was an 80% reduction in greenhouse gases, and that passed in 2009, but killed by the Republican efforts in the Senate with according to Yale University, the largest single amount of money ever spent to defeat any bill in the history of the United States. So that's where we are. And the good news is we have young people, we have the public health community now all rallying in order to try to have the United States not be the laggard, but the leader in the years ahead. And ecoAmerica, we thank you for all of your efforts. And this National Health and Climate Forum is absolutely where we have to be. I thank you, Dr. Goldman, for your historic leadership here and all the work that you do on all of these issues. So it's just, it's an honor for me to be joining you today. So many of you who provide life-saving, life-changing services to communities. This year, we've had the hottest summer ever on record. And this summer should enjoy that record because next year is likely to break the record, and the year after that, and the year after that. So that's just where we are. We've seen rising tides make storms deadlier and more destructive. Hurricanes are more likely to form, persist, and expand their pathways northward to places like Massachusetts, up to Vermont, which got flooded this summer. Disasters supercharged by climate change are devastating communities, and we know they aren't affecting every community equally. Black, brown, indigenous, and low-income communities are on the front lines, disproportionately harmed by extreme weather events. And the same is true for the deep inequities in our healthcare system. 100 million Americans don't have access to primary care. More than 600 hospitals face risk of closure. What's more, these crises of climate and health only compound one another. Changes in temperatures and rainfall patterns, the symptoms of climate change are making some infectious diseases spread more easily. The next pandemic may very well be aided by more favorable conditions for pathogens, thanks to climate change. Extreme weather fueled by climate change takes out power systems that keep hospitals and clinics running, forcing health ration diesel, close their doors, and leave patients without care in the aftermath of a storm. Pregnant people are left without prenatal care. People with opioid disorder are left without medication, treatment, and support. Kidney patients don't get dialysis. Americans have health needs that don't stop just because access to care does. And it doesn't have to be that way. Our healthcare system accounts for 8.5% of our nation's greenhouse gases. Our healthcare system accounts for 8.5% of our nation's greenhouse gas emissions. And that share continues to rise. These emissions are connected to as many deaths as preventable medical errors. Talk about undermining the health outcomes that you, the providers, the health centers, the medical innovators are all working hard to improve. But there's hope because that 8.5% of nationwide emissions is within our control to change. It's something that we can tackle together right here in the healthcare sector. We have no choice but to act in the midst of these compounding crises. We can save people and our planet. We can ensure access to care, keep the doors open through stronger storms, hotter heat waves, and bigger wildfires, while we simultaneously work to ensure we're protecting our families from extreme weather events. Our healthcare system can't make people sicker at the same time that we're trying to make them better. And no one knows that better than you do. Time and time again, we ask that our healthcare heroes show up while the rest of the world shuts down. Without fail, you deliver. You know that climate justice is health justice. You have stayed and served your communities through pandemics, extreme weather events, billing nightmares, and more. You have been essential to developing health system solutions that are responsive to our climate crisis. You know every corner of our healthcare system and every opportunity that we can't afford to miss. You came to lawmakers demanding fixes for interconnected emergencies. You shared your stories working on the front lines, underpaid, overworked, and understaffed. You advocated on behalf of your patients who faced down one pandemic only to fear that we'll have to prepare for more of them and more often. When something's not right, we don't agonize, we organize to fix it. Our healthcare system is not built to work for patients nor healthcare providers, and it's certainly not prepared to take on the climate crisis, or at least not yet. Now it's time for the rest of us to deliver for you. You wrote the prescription for what is ailing us, a whole of government and whole of health approach to the intersecting climate and health crisis that we are working to get it filled. That is why I introduced the Green New Deal for health. It's a national treatment plan to build a healthcare system that delivers deserve. The Green New Deal for health boldly reimagines our healthcare system, bringing together the principles of the Green New Deal, good paying jobs, justice for all, and a livable future to create a healthcare system that people deserve. It would build a healthcare system ready and able to take on the climate crisis. It would strengthen our healthcare system to better take care of those already vulnerable to climate exacerbated illnesses and to prepare for all the more who are suffering the effects of extreme weather, polluted air, natural disasters, asthma, more frequent pandemics. It's all there right now. What we breathe, what we get exposed to, it's all part of a common public health story. We can revive programs from the New Deal era to modernize and weatherize our medical facilities to ensure that people are able to get care before, during, and after a crisis. It would protect and empower not just patients, but you as workers who make high quality, dignified healthcare possible. It would equip you with the tools and the protections you need to perform the essential life-saving work that you perform. It would also ensure that our healthcare system, the system you are all fighting the good fight in each day and every day, that it isn't making the climate crisis even worse. It would support people in their communities, in their workplaces, in their homes, and on our planet, live the lives that they deserve with health, safety, and dignity. It's a bold and a necessary investment of over $400 billion at every part of our healthcare system, from community health centers to medical facilities to our healthcare workforce, because each of you has a vital role to play. At a time when clinics are closing their doors and turning out the lights, we're fighting to ensure that there is lighting on the path forward, to keeping the doors open. At a time when workers have to show up when the world shuts down, we're providing hazard pay and fighting against union busting activities that want to take down worker power. And at a time when patients are seeking health, we're healing entire communities. As Pope Francis reminded us in Laudato Si', his encyclical on climate change, Laudato Si', everything is connected. Concern for the environment thus needs to be joined to a sincere love for our fellow human beings and an unwavering commitment to resolving the problems of society. The prescription for what ails us is clear. We need a whole of government and a whole of health approach to the intersecting climate and health crisis. We cannot afford the price of inaction. We must commit to building a healthcare system ready to take on climate change, a healthcare system that both patients and providers deserve, a healthcare system that prioritizes people and not profits, and a healthcare system where everyone doesn't just survive, that they thrive. For climate justice, for worker justice, for health justice in our society, we must all partner together for a Green New Deal for healthcare in our society and be the model for the rest of the world. Laudato Si, it is all interconnected, and climate is the play a role where we're all going to live together or we're going to die together. We're going to know each other or we're going to exterminate each other because of climate change. And we have a chance to make sure that we have a healthy planet and the healthy lives for everyone that lives on that planet. So thank you all so much. Thank you for having me here today. Much appreciated. Thank you.
Thanks, Senator Markey.
Glad to do it.
That was spectacular, and you've really given us a couple of big challenges. The 8.5%, I think that number should sear into everybody's brain because we're asking everybody else to stop. And then, of course, supporting the Green New Deal for healthcare. So congratulations. Thanks so much again.
Friend. Thank you all for everything that you do. Everything.
Well, that was really good. Okay, where's the clicker? Okay. Oops, let me go back. Oh, no, Bob. All right. Whoops. No, I got it. All right. So, pardon me for being casual here. These are serious topics, and we all have to put a lot of energy into it. And I've been putting a lot of energy into it this week. Climate change, there are a bunch of facts about climate change that we all know, but there are a bunch of unknowns still. And all of us have different perspectives, and therefore we have different priorities on climate change. It's undeniable, it is unignorable, and concern is growing in America. And I just wanted to focus on one metric here. Because you can go 5% of Canada burned this in the last 3 months. Can you imagine driving down the road and saying every 20th house burned? That's what just happened to Canada. And Greece, largest wildfires ever in the history of Europe. Greece, floods where there have never ever been floods in history. It's just all over the place. But I just focus on one place and one thing, and that's the United States, and this is NOAA. This is billion-dollar disaster events. And if you look from 1980 to 2005, you'll see that, hey, we had 1 year above 9 events, but you average it all out, it's about 4 events a year, 3 to 4 events a year, 1 every 3 or 4 months. You've got a big weather problem. All of a sudden, then you go to 2005 to 2015. Well, that's 2005 to 2018, let's say. All of a sudden they're jumping up and there's nothing under 6 anymore. And as a matter of fact, the number of events have doubled. The dollar cost for dealing with them has doubled. They doubled in that period of time. And then if you look at the next 5 years, the last 5 years, it's doubled again. This is the definition of an exponential curve in real life. And this is the 2023 number, all-time record. Hey, it's September. We're only not even 3/4 of the way done with the year yet. So this is what's happening all over the planet. It's not just weather in the United States of America. And as the senator said, it isn't going to stop. This is not only the hottest summer we have ever seen, this is the coldest summer we will ever see. And we need to address this in a comprehensive, effective way. Otherwise, we're going to pray for summers like this summer. And then if you take a look, there's 2 things on the left. One is the solutions are already here. The bar graph on the left shows this transition from fossil fuels, coal, the black line, to renewable energy. We were 15 years ago, we were 95, 99% fossil fuel based utility scale electricity. Now we're 5 to 10% fossil fuel. So but we are not replacing the existing infrastructure fast enough. If you look down at the curved lines here, people have always said, oh, we've got 10 years to address climate change. That's 10% in 2021, 10% in 2022. No, solutions work like the problems do. Solutions work in exponential curves. You got to figure out how to build cars, batteries, and then you make them better and better, and everything builds up. And so the red line is what's going to happen with solutions. It's happening in an exponential way. So we've got two exponential curves chasing each other right now. And we have to do everything that we can to get that red curve line going up as fast as we can. And people will say, hey, forget about direct air capture, carbon removable and stuff like that, because it's going to be too little too late. Pardon me, we got to focus on everything. We have to get as much clean energy as we possibly can out of the system. So the net of everything is, last week, the UN issued their global stock-taking report, and that global stock-taking report said, we are way behind in all these areas. The great thing about it, there's got like 14 points of what needs to be done. It's a very solutions-oriented document. And then at the same time, let's see, that was 2 weeks ago. Last week was the Planetary Boundaries report, where they say the 9 different areas of things that if we cross the tipping points, and we are past the tipping point on 6 of them right now, but we can rein those things back in. We just have to stop thinking of, hey, let's do incremental, this much better. If the senator says 8.5%, we should all put that in a signature in our lines right now and say, healthcare, medicine in the United States is 8.5% emissions. What are we going to do to get that to 0 as fast as they can? What are you going to do as individuals? I have personally decided 5-7 years ago that I'm going to die having left no emissions on the planet. And not eliminate my emissions for this year, but for my whole lifetime. And then what I do is every year I calculate my emissions. I buy 5 years worth of them. And I'm going to feel good for myself that I'm living my values and I'm stopping emissions. But I would challenge all of you to say that, hey, I don't want to just have 0 emissions this year. I want to have 0 emissions for my whole life. And the most important thing you can do besides living your values is sharing your values. So you need to talk about those values. You say, hey, why did I ride a $400 scooter to work? Why do I ride a $400 scooter all over the place? Well, because, by the way, it saves me about $20 a day. It pays for itself every month. But beyond that, it is just, why should I drive a 4,000-pound car with emissions? Why should anybody drive a big SUV? But anyway, live your values, share your values. All right, so then how do we move society? ecoAmerica's job is to move society to climate solutions. The middle thing, if you do the IPCC mitigation report that came out earlier this year, you notice that there's a new Section 5 in it. And the new Section 5 is about social drivers for climate change. Gosh darn, the UN, it's in the charter for the IPCC to educate the public about climate change, but no one ever does it. But they are, for the first time, saying, hey, that if we don't get more public support, we're not going to solve this problem. IMF came out with a report in March, and it says more public support needed for climate change policies. And then my favorite is Hamburg University in Germany. Every year they issue a report and they say, can we solve climate change or not? And they say, we can solve it. And then about 2 years ago, they said, we can solve it, and we keep saying we can solve it, but we're not solving it. And then they came up with the concept of social drivers for climate change. And they said, without greater public support, we're never going to solve it. It's feasible for us to solve it, but without public support, it's not plausible that we're going to solve climate change. So that's what ecoAmerica does. On the right, there's something called social identification theory. If you're going to move society forward, what you're going to do is you're going to look at people as groups, like, let's say, public health professionals. Okay, you can be a self-reinforcing, we together can be a self-reinforcing group of people. But if you think of people as individuals or, you know, groups of people that are not connected, you're not going to get very far. You have to think of your workplace, your community. You have to think of it as a group. And you can walk into your workplace and say, what are we doing? We need to go climate neutral now. Can't you pay attention to even the weather outside? We all need to do that stuff. And so that's what ecoAmerica is doing. I want to thank all of the leaders here, the executive committee for the health sector. Ben's going to tell you all about what's going on with that. We've got a great group of partners. We've got programs, resources, and we've got a great awards program. Everything is dedicated to one thing, moving society toward climate solutions. And I think, I wanted to show you, this is Washington Post last Thursday, front page. Climate-linked ills threaten humanity. Okay, and there were 3 national newspapers last week that said on their front page said that, hey, we're all going to die. Okay, and we don't have to die. I've got some beautiful grandkids. I don't want to die. I don't want them to die. But you know, we all have to start thinking of not incremental stuff, not doing a little bit. Take your life, go all the way there. Take your neighborhood, take your workplace, take your community, go all the way to bright as fast as you can. And with that, Ben, thanks for putting this all together for us.
Thank you so much, Bob. Great. So like I said, I'm Ben Fulencio Turner. I'm really proud to be directing the Climate for Health program. So it is an incredible initiative of so many different national associations and organizations. We work with those national leaders on developing tools to reach membership and help make that connection on climate and health, and help people understand how they can start taking action as on-the-ground clinicians, public health experts, academics, and start bringing this into their work, into their social life, into their community. And so we've heard already a lot of bad stats, a lot of distressing numbers. And so I just want to share a couple good news numbers. So first, in our recent American Climate Metrics survey, ecoAmerica polled the population of the US. We found 85% of people agree that we have a moral responsibility to create a safe and healthy climate, 85%. And this cuts across political divisions. There's large majorities of people who identify as Republicans, Independents, Democrats. People have a consensus on that moral responsibility and those core values. And it's around healthy, safe environment, and it's related to climate. And 69% of Americans agree that climate action will improve health. So that's really to say that this work of engaging people matters. It makes a difference. We are pushing on an open door here, that the people are motivated to act on climate because of the health impacts. The health impacts are real. They understand, a majority of people understand that taking action will improve the health of their community, their families, their children and grandchildren. And so making that connection and focusing on that is a way to really drive forward progress. So among our many partners we work, I'm really excited about this partnership with the National Association of Community Health Centers. We just have this on as an example of the kind of work that we do with our partners, working down from, we started our partnership late last year. Since then, we've trained hundreds of their members. We are featured in multiple conferences on, again, they have programs focusing on climate impacts for health and what community health centers can do about it. What we're working on is translating that to the on-the-ground clinicians, clinic managers that are really on the front lines of climate change in this country. So incredibly rewarding work. This is a huge association of clinics. My background is in safety net healthcare, so it feels very personal to me. And so again, we're really excited about these kinds of partnerships. One of those is the Climate for Health Ambassador Program. I'm sure most of the people here are familiar with the ambassador training. So this is about 3.5-hour training, gets you up to speed, able to talk about how climate change affects health. I found that the more letters you have after your name, often the more hesitant you are to talk about something that might be outside of those expertise areas. You know, ooh, that's a little too technical, I'm not sure, I haven't studied that. This really aims to get people that base level of understanding, as well as a really strong communications training on the best practices to engage on it. So we'll be talking more about this and having more opportunities to engage with it. And then we also have the Climate RX badge program. I'm wearing one now. There are many more out on the table. This is aimed just to make it as easy as possible, lower the barrier for you to talk to patients, colleagues, community members about climate change from that health lens. Bringing up climate in the lens of health sticks with people. And so making this part of those interactions, part of the bedside interactions or community interactions, can really help to drive change in lots and lots of people's views on climate change. So we want these impacts, as however small they are, those individual conversations, they have a collective impact. You are pushing on those open doors of people's values. And so we're going to be focused a lot today on these different kinds of solutions. It's what I do every day. And so I think everyone here has my contact information. Always feel free to reach out to me to chat more about it. And these are a few examples of these kinds of local actions. Like I said, these actions on the ground are things that we want to lift up, help people to spread what works. And then when they've achieved something, celebrate, amplify, make sure more people know about it, make sure those people are recognized and are celebrated. And so again, if you've done something like this on the ground, talk to your community board about solar panels on local church buildings, or gone to your school board meeting and talked about electrifying school buses and taking advantage of those funding. We want to know about that. We want to help you amplify that. We want to help tell that story so that more people can amplify that. And you know, don't be shy about wearing your stethoscope or lab coat, or talking about your credentials as a public health expert in those conversations. It opens doors and pushes on those buttons that people really that link up with people's values.